Today we will talk about coronary disease. Coronary artery disease develops when the major blood vessels that supply your heart become damaged or diseased. Cholesterol-containing deposits in your coronary arteries and inflammation are usually to blame for coronary artery disease. The coronary arteries supply blood, oxygen, and nutrients to your heart. A buildup of plaque can narrow these arteries, decreasing blood flow to your heart. Each year, CVD causes an estimated 17 million deaths worldwide, accounting for 1/3 of all deaths worldwide. More than 1/3 of these deaths occur in middle-aged adults. Sign and symptom of coronary disease are chest pain. You may tightness in your chest as if someone were standing on your chest. This pain, called angina, usually occurs on the middle or left side of the chest. Angina is generally triggered by physical or emotional stress. The pain usually goes away within minutes after stopping the stressful activity. Shortness of breath. If your heart can't pump enough blood to meet your body's needs, you may develop shortness of breath, heart attack. A completely blocked coronary artery will cause a heart attack. The classic signs and symptoms of a heart attack include crushing pressure in your chest and pain in your shoulder or arm, sometimes with shortness of breath and sweating. Risk factors for coronary artery disease include smoking. Uncontrolled high blood pressure can result in hardening and thickening of your arteries, narrowing the channel through which blood can flow. High levels of cholesterol in your blood can increase the risk of formation of plaque. In atherosclerosis, type 2 diabetes, and coronary artery disease share similar risk factors, such as obesity and high blood pressure. Overweight or obesity. Excess weight typically worsens other risk factors. Unhealthy diet. Eating too much food that has high amounts of saturated fat, trans fat, salt, and sugar can increase your risk of coronary artery disease. A family history of heart disease is associated with a higher risk of coronary artery disease, especially if a close relative developed heart disease at an early age. When to see a doctor. If you think you're having a heart attack, immediately call 1669 or your local emergency number. If you don't have access to emergency medical services, have someone drive you to the nearest hospital. Drive yourself only as a last option. If you have risk factors for coronary artery disease, talk to your doctor. Your doctor may want to test you for coronary artery disease, especially if you have signs or symptoms of narrowed arteries.
Created using Powtoon.